Be starting our session soon as we welcome people and would like to highlight the fact that we are live. It's good to see you, Jagruti. And Pranabda, good to have you back.
Fine.
You have become a celebrity, Pranabda.
My goodness.
Very much in demand all over the place. How lovely is that?
And it is for your all support, inspiration, Bhavana.
You're so kind.
You are there.
So as people come in and request, my colleagues Nabia and Anish to help me host this session today, I would like to welcome you to our 21st webinar on understanding caregivers and their psychological well-being. This is in our series of webinars that we conduct under the brand of Compassionate Caring. And today's title is When Parents Are Caregivers to Children with Terminal Illness. As you can imagine, it is a difficult topic. It's a challenging situation. And I am delighted, honored, and absolutely privileged to be having this conversation today with Dr. Armida. And welcome, Dr. Armida.
Thank you. My pleasure, Bhavana.
It is lovely to have you with us today. And I know that you have supported Caregiver Saathi from its very beginning, and me in particular. So I feel very warm and nice, and it's actually quite a dream that you and I will be having this conversation. I'm going to take a little while and talk to our audience about Caregiver Saathi and a brief introduction to Caregiver Saathi, the work that we do, so that you're all familiar. We are trying to create an ecosystem of well-being and healing for the primary caregiver. Family caregivers of those navigating terminal illness, chronic, or any other life-limiting conditions have unique challenges, and we support them through their caregiving journeys and beyond. Like I often say, family caregivers are invisible, unrecognized, underappreciated, and underserved. And we would like to shine the light on the family caregivers so that they can feel supported in sometimes what they feel they are duty bound to do, and sometimes what they feel can be a difficult journey that they have no space to go for. So we wish to create an environment of well-being by helping the caregiver feel empowered, help the caregiver and their ward or the care receiver lead full lives. And today's conversation is going to give you such a deep insight because the person that we have with us is such a living example of such an experience. But how do we do what we do? We would like to leverage technology, which is a part of our everyday lives. Today, we can have this webinar because technology has enabled our lives. But technology is useful only to an extent, and there is nothing like human connection. So we would like to leverage human connection through technology, or we would like to leverage technology and make better human connection. For the awareness programs, the education programs that we conduct, we have a helpline, we conduct healing circles or support groups for family caregivers. We are able to reach out to a larger number of people, of course, through social media communication, which is essential to create awareness and sensitivity. We are building a platform through which we will provide access to relevant information that caregivers can avail. And finally, we are building a technology-enabled support system, which is a platform as well as an app. What have we done so far? We have built a platform, an app, and a website. We conduct training programs or education, both online and offline. We have an app. We have a community that operates on the Facebook social media as well as on WhatsApp. We believe storytelling can be a powerful tool for changing social narratives. We look at caregivers as gentle warriors, and we believe these gentle warriors must tell their invisible stories on an ongoing basis. For example, we have with us Pranab, who has told his caregiving story in so many forums. I am sure it helps in his healing as much as it helps in many others feeling inspired. So these gentle warriors and their stories must be told. We tell these stories both through our videos as well as our podcast. Compassionate Caring, which is this program or our webinar series, is about bringing in experts who will share their perspective on caregiving and caring. The idea being that compassionate caring is a healthy balance of both the caregiver as well as the care receiver. So compassionate caring can be practiced so that caregiving is not at the cost of the caregiver. We provide one-on-one caregiver coaching and family counseling. And finally, we are in the process of building a volunteer-based respite care program. So if you're interested in volunteering for our program and undergoing the training to be a volunteer to support family caregivers, get in touch with us, register on our website. There are many ways in which you can participate, join the healing circles or support groups. One might wonder, if you are not a caregiver, why should you join the healing circles? Well, you should join the healing circles because caregivers might find it difficult to be a part of the healing circles themselves. And it is absolutely essential that well-wishers learn what the challenges of caregiving are. And well-wishers, as much as active and experienced caregivers, need to be a part of the healing circle so that we can create an ecosystem for the family caregiver. Of course, caregiving stories are hard. They are not just always stories about bravado and stories about success. Some are heartbreaking, tragic stories. But they must be told nonetheless, because that's what makes us human, and that's what inspires us to persist with what we do. You can help us spread the word, both in person and on social media. You can certainly volunteer with us, and because we are a donation-based organization, not only can you donate, but help us raise funds as well. Last year, as per last count, we had 42 interns who interned with us in various roles, and we are very excited. I never thought that so many youngsters would be inspired and interested in a subject like caregiving, but I have been proven wrong, and one of those occasions when I'm happy to be proven wrong. Internship is something that we offer to certain students who may be interested in pursuing understanding of a startup in the healthcare space, a social development space, or psychology. Again, more information on our website. Certainly, we would like to reach out to institutions like hospitals, organizations, partners, clubs, societies. And for that, if you are a part of our ambassador program, you could help us open those doors, and we would be delighted to have you in the ambassador program. Please register on the website and we will get in touch with you with the details. There is a framework that we use for one's well-being and building resilience. A caregiver's well-being, the way that we look at it, is a composite of 7 elements. At the core is physiological, spiritual, and psychological well-being. This is inner to an individual. In terms of interface with the world, there is social, financial, and legal, life and work purpose. And existentially, there is the final element of our creative expression. We consider all the 7 elements of well-being as we support caregivers in their caregiving journey, which can demand a lot of resilience. Stress is caused by imbalance in well-being, and unaddressed chronic stress could lead to mental health issues. So we believe that building resilience can be done through practices of mind, body, and soul. So you could register for our programs to build that resilience over a period of time and derive satisfaction from your caregiving journey. With that, I am reminded of the first time that I met this wonderful lady that we have as a speaker today. And I can think of the sheer warmth with which she met me and absolutely, welcomed and embraced the idea of Caregiver Saathi. I will be telling you about Dr. Armida Fernandez's spectacular academic and professional achievements. But let me tell you, she holds a very special place in my heart. She is a retired professor and dean of Sion Hospital. She was the medical director of Holy Family Hospital, Bandra, and is the founder trustee of Sneha. She is working in the area of neonatology in India through the use of low-cost technology. She has also made breastfeeding easy for many in the country by starting the first human milk bank in India. She's been awarded numerous times, and let me tell you, when we first saw her profile, it ran into 3 pages. So we have decided that we will give a brief introduction to her and maybe just have her conversation with her. I am sure you can find tons of information on her. Such a spectacular academic and wonderful human being. Welcome, Dr. Armida.
Thank you, Bhavana. Thank God I feel embarrassed when people show my CV on a slide. Very embarrassed.
Well, we are very, very proud, and it gives us a lot of comfort and it gives us a lot of support. So thank you for who you are and what you do and what you have done. Just some housekeeping announcements. We will be spending the next 60 minutes having a discussion. There are 3 big parts of our discussion. We will be having a conversation. So Dr. Armida and I will be having an exchange. And then this part of the conversation is live, both on Facebook and YouTube. However, we will have a question answer session, which will not be live, so that you can feel safe to ask your questions of her and seek clarifications or further information. And finally, we would love it if you can give us feedback and suggestions so that we can improve and do what might be more meaningful for you. Please keep your microphones muted at all times so that we can minimize background sounds. If you're seated and your camera is stable, keep it turned on. Otherwise, request you to turn off your camera. We are recording and some sections are live, like I mentioned. We would love for you to give us feedback on the questionnaire that will be shared towards the end of the session. We will be using this discussion for designing further programs. That's for your information. And with that, over to you, Dr. Armida. Tell us how you relate with today's topic and Caregiver Saathi.
So to start with, Bhavana, let me congratulate you on this wonderful Caregiver Saathi that you started. It was something really needed because I know in life and seeing so many caregivers to patients that we come across even in the hospitals, you realize that there is so little support for these caregivers. It's not in my particular case, but in general. And I think this was very much needed. And I remember you talking in Kerala. I was so taken up with your talk, and I came and met you and said, what a wonderful job you're doing. So I'm glad you started something like that. Having said that, when you asked me to talk on this subject, when parents are caregivers to a child who's terminally ill, to their children who are terminally ill, my first thought is, no, I'm not going to do it. Because somewhere, some memories are best forgotten or buried in the past. And then you don't want to excavate these memories, bring them out to the surface, and relive moments that you would rather have forgotten. But when I thought over it, Bhavna, I said, I'm keeping these memories to me, but there are so many things I have learned, so many things that I did right, and many more things that I did wrong. So I keep them with me. It will die with me. And if I share it with other people, with caregivers, or share it with those who care for caregivers and are willing to reach out to caregivers, they may learn something. It may help people, and what happens is, caregiving, it's not some gift you're born with.
That's
And
right.
caregiving cannot be learned. I know people are trained to be caregiving, but that's different. But when you're a parent, when you're a relative, only they know what they're going through, and therefore someone else who's gone through it, if we share it, I think many more people, I hope it could help other people. And that's why I'm here today, willing to share with you whatever you would like to ask.
I am so grateful, and on behalf of everyone who knows you and who knows and who will be watching this, thank you to start with. And, just please visualize we are holding your hand virtually, as I know that you might be visiting some memories that might be hard or painful or difficult, but we will only be richer. And like you rightly said, we will be very, very grateful for your wisdom. So thank you for deciding to do this topic. So would you like to tell us what your caregiving journey was about?
So, Bhavna, let me start with talking about my lovely daughter, Romila. She was, Romila means heartfelt. And she was born to be, she was like that. Her heart was the most important thing, and she loved people. She didn't know what she could do for people. And, they used to call her Mother Christmas. Whoever she met or felt, she would give a gift. So she was really a loving child. The second thing about Romila, and I think it's nice for people to know, because that's how, when you're a patient, Romila loved life. She loved everything that was good in life. She loved to eat. Where will we have our next meal? She loved, she loved to travel. She loved clothes and jewelry, so everything in life. And she really lived up to it every day of her life, every minute, till the last 6 weeks. I think she made the most of life. And I think it's a lesson for everyone, that whatever you're going through, you must learn to make the most of every minute of your life. That's the second thing. The third, Romila was born to, in many ways, suffer. Because, this is the caregivers to a terminal illness, but Romila was ill from the third day of life. From her third day, she needed 3 exchange transfusions, third, fourth, fifth, because she had high levels of jaundice. That was one. And, I never knew whether she would live through it, because many, many years ago, when people didn't go through an exchange transfusion safely, then the fear that her mind, she would be retarded or have problems because of the high levels of. She did well, fortunately, but at the age of 16, we discover she has one type of cancer called Hodgkin's lymphoma. And then maybe we'll take off her picture off so we can talk.
Yes.
So she suffered from Hodgkin's a lymphoma, which was a lot of chemo, some surgery and all that itself, from which she recovered again. And finally, in the third episode, she gets cancer, one breast, then the other, which meant a lot of, all along, blood collections, chemo, surgeries, radiotherapies. So it was, she went through a lot in her life. And therefore, I think for a person like that, who loved life, but till the end, she kept smiling, fighting, and living life to the making the most of her life.
Yeah. Um, I'm at a loss of words, but so as a mother who had this young child, can you revisit those days and tell us what your big challenges? Let's say when she was really young, she was in the first, second day. What was that about?
So let me tell you, when she was my first baby and I was waiting to have a baby, and then on the third day, and I'm a pediatrician, know what the complications are. She gets us on. I think I was, what would I say, desperate. I was, almost like couldn't accept the situation. I felt desperate. I didn't know, helpless in many ways. What can be done? And so at that time, I was really, really, really very upset, emotionally and physically. I think they had to sedate me because I was so emotionally, it's not anger so much, but the feeling of desperation. I think I was desperate. And that was what I went through when she was first in. But let me tell you also, Bhavana, she recovered. But because of what she went through, I could hear her cry when they collected her blood. I could hear her cry when they exchanged her blood. They don't anesthetize. You are conscious when all this is being done. I think I became a much better doctor because I knew what pain was. I knew what babies went through. I knew what mothers went through when their child was ill, when the child was suffering. So I think as a neonatologist, I made sure that no baby should unnecessarily suffer pain. Cut down as many, blood collections as possible. Get the mothers into the unit to hold their babies. So it changed my whole outlook to what sort of a doctor I was. And that was a huge lesson. I might have gone through hell, but that was a lesson I learned, and that's how I changed because of what I went through.
Just catching my breath as well. What might that have meant for a younger you? And today, when you look back, you can probably say that that made you a better doctor. But I'm sure it was quite a tumultuous and a very difficult, thing to go through in that moment. When as you look at the 3 significant stages of caregiving for your firstborn, what do you see as a common thread or things that were most critical, or what would be the life lessons that you would want to share with other people who are in similar circumstances?
So you know what I feel, Bhavana, because what she went through, and even when she first had a cancer, the first cancer she had, and later on, you get these feelings of, sometimes angry, sometimes depressed, sometimes helpless and frustrated, not knowing what to do. All these feelings come in one after another. And I think at that time, because I think what made me, helped me go through what I did was my immense faith in God. Sometimes I wonder how people who don't believe in God go through these very, very difficult, desperate times in their life. Whom do they look up to? Where do they search for support? And you can't explain it. You can't explain it. You don't know what to do. I think that is one thing that kept me going. And the second thing I think that helps a lot, and this is what other caregivers is, that you must look for help. Who's the best person to support you in that time? And I remember, in each stage there was a different. When my daughter was a newborn baby, I had my brother-in-law, sister, all of them rallying around, helping. my whole department of pediatrics, the head of the department was in the hospital doing the exchange, the whole department was around. So you felt, when people are around you, and, it's not people who say, how sad, I'm so sorry, everything will be fine, these sort of words. But people are there doing things for you. In the middle of the night, brother-in-law bringing someone, so, or the residents around there doing things that they needed to do. So that was the help. Secondly, I remember when she had to undergo her first time chemotherapy, I did it at home when she first had cancer. And because my daughter refused to go to the hospital, and the nurse from Tata could come in the evening, but so I was alone with her at home, but my nephew was very close to her, and a very close friend of mine who, every chemo, they were there to support me and to support her. Someone she trusted, someone she loved, and she felt their love as well. So I think you need to look at that. And of course, the third time when finally the end of life, her husband was there. And I can't forget the support because we supported each other. He was there every single minute, every single second, didn't leave her at all. So when you get this sort of a support, it helps you go through what you want to go. And many times, people, why I need to share this, very often people want it to be a secret. You're ill, someone is really ill, someone's got cancer, someone's dying. They don't want to tell anybody. And because they don't want to tell anybody, they don't get the support they could have got. So I think that really made a difference.
So I think sometimes it's complicated because people feel they will get sympathy and nobody wants sympathy.
Yes.
And sometimes you feel that, there will be, maybe people will go away also. Sometimes people run away from illness because they are not able to face it. So I think it works in some very strange ways. How did you take care of yourself through all of that? How do you take care of yourself when you are looking after someone else?
So I'll tell you, Bhavana, and this is also important to remember that I told myself that I'm lucky. And why am I lucky? Because I've seen so many babies dying in the hospital and I've seen their mothers with them. And let me tell you, when the newborn babies are there and the baby was a girl, no relative came. The husband didn't come. So the mother was alone in that ward with the baby who was dying. And then, I said, look at this. Look at her suffering by herself. Sometimes if I put my hand around her, she would start crying because there is no one else to support. So, here I said, I have all the support and here are people. The second is I kept reminding myself, I have a roof over my head, we're eating. I can get the best treatment for my daughter. I've got, we can afford it. And what about people whose children are dying and they don't have the support to get? So I had to keep reminding myself how fortunate we were, how fortunate my daughter was, because we had support, we could have people, we could afford it. So that's the second, way I kept on telling myself, no, it could have been much worse. I could have been in someone else's shoes and it would have been much worse. The third thing I think, Bhavana, that I did, I don't know if sometimes I think, did I do it right or did I do it wrong? But I kept myself busy. When you say busy in the sense that I continued working. When she was 16, I was very much in Sion Hospital. So I used to work the whole day, come back in the evening and give her the chemo. It's not that I stopped working and I took so many months leave and things like that. And I think when you go out and you're doing other things and seeing other people, treating other people, your mind is taken off from what is happening. On one side, yes, maybe it helped me to some extent because my mind was occupied. But on the other And when I think of it, I said, would it have been better for me to be with her? And was that what she wanted? She never told me, Mommy, stay at home, don't go. So, it's a balance. But I think this is something to balance, because when you give up everything and you sit at home and finally you lose your daughter, you're at a, you don't know what to do with your life. You've lost so much, so many years just looking after, being a caretaker. Then there is an empty world, an empty space around you. So I think it is extremely important to, keep yourself, but, I think balance that time, how much time and how much time you don't spend or you don't spend. So I think that also helped me. And I think to some extent, yes, prayer, because I told you faith and prayer, you can't pray. Those words don't come, but in some way, either you sing or, like songs, whatever it is, that tell you that you have that faith. So you sort of, today they talk of yoga and meditation. I could never meditate in my life. My mind is all the time wandering. But I think if you keep your mind busy with other things as well, it gives you some time for yourself, and then you have the strength also to cope with what is happening.
In my interactions with many of parent caregivers who are faced with the very tough challenge of, a child, I have also found extreme circumstances in which, first of all, I think the parents are, very caught with why us and why is this unusual thing happening to us. I find it very endearing when you say that you thought about how lucky you were, because by contrast, most people think of how unlucky we are. That this is unnatural and this is unlucky, and that can probably take away your ability to be resilient. The second thing that I think having some kind of a faith and belief in a higher power, whatever your higher power be, can be a way to turn over your worries to someone else,
That's right.
And I really like the idea for a woman of your times who was pursuing her career with this challenge. You must have really stood out. You must have really challenged society in so many ways. I mean, even I find women and mothers, myself included, feeling very torn between being a mother and being a career woman. And if I have to look after a child, then, that much harder. How did you cope with that? Did you have to hear anything?
You know what, I think I coped with it. I didn't cope. I think my daughter coped with it. Because I remember very well when she first was, she had a gland in her neck and we had to operate on it to find out what it was. It turned out to be Hodgkin's. It was the same day when I was having a seminar in Sion Hospital. And the surgery was, early in the morning, and I said I'll rush back to be on time because I was giving the talk. So when I was there with my daughter, the surgery was over, and when she opened her eyes, what's the first thing she said, Bhavana? She said, Mommy, are your slides ready? I make sure you go in for your talk. So, it depends on who the person is and how much he cares for you. So I think what gave me the strength is her temperament, her attitude on what we done. And you know what? The other thing about the attitude that helps, chemotherapy is over, and 2-3 days she couldn't go out and all. The moment it's over, now let's see where we can eat. So she would choose what to, and then what shall we shop. So that attitude, I think I was fortunate. I still say I was fortunate in a way because of her attitude to life. And also she said, now when she was ill, with her secondaries, and she had also diabetes, hypertension, I don't know, 2 strokes and all. She said, we will travel. And we traveled all over. I was wondering, I don't know what will happen when, because she had so many complications. But her will to do that, and of course, with my heart, I don't say I enjoyed that traveling because my heart was in my mouth. But I think what helped me most was that. And I think for all those people who are there, as we live, we must tell ourselves that, life is short, make the most of it, enjoy every minute. In any way, don't say, I can't do this and I can't do that.
You must tell me about some of the holidays and the best memories that you have from your holidays.
Yeah, you know what? I remember her, one of the holidays she chose was Turkey, and I was very, very nervous. Turkey and Egypt. So I asked one of my colleagues, a very close friend. That's why I said always reach out to people to help. And I said, do you want to travel? We're going to Turkey. And she said, yes, of course, I want to travel, Shanti. So what we did is we went together, the two of us with. So I knew that I wasn't alone. I had a doctor by my side who was cool and collected. And we had such a good time, shopping. I still have the things that we bought. And she bought things like lamps and glass. I said, how will we carry it? She said, don't worry, I will carry it. And we made sure it all came safe and sound. So these are really lovely memories that I have, that when we travel. I remember South Africa. I don't believe in the best. I said, we have to go to average 3-star places, stay and all that. When we reached there, I saw what a lovely place we are in. I said, my God. And she had changed it with, in collision with the travel agent. She said, not this, I want the best. So she not only had a good time, she made sure we also had a good time.
I just love the idea of such beautiful memories to look back on, and such great moments. It looks like, when you approach your challenging times, sometimes difficult caregiving, with a view that, you want to live it without regrets. It seems like I'm making a note of that. Like, what can I do to not have regrets?
But why it is important? Because many people caregivers who are with their patients, they do things that really torture the patient. No, this is your diet, don't eat this, and you must not do this will harm you. So they make their lives, when you know that the life is limited, that things might go wrong anytime they're not going to live long. I think they must allow them to make the most of life, to be happy, to laugh or eat or things like that. And therefore you have these sort of memories always, not of not doing this, not doing that, but doing what you want and enjoying it.
I mean, like Sonalini is saying, you're such an inspiration to all of us. It is, it must have been so hard. I can only imagine and dread. But, thank you for giving us a peek into such a private part of your life and journey. I can only imagine what must be going on right now, even as you talk about this. Would it be okay for you to tell us about some difficult emotions or some difficult incidents in your journey?
Yeah, you know what? I think there are many things when I look back, and I think I want to share this with other caregivers, because they shouldn't go through it at the same time. What is it I didn't do right? And I think the first thing I didn't do right is I didn't tell her the truth. When she had Hodgkin's disease, and it was a cancer, but I told her, no, it's a rubber disease, we'll melt it. And she came to know it was cancer sometime later from someone else. She was 16 and she was very, very upset. So I think sometimes when your loved ones ask you what is wrong with me, what is happening, I think we don't have to use the harshest terms and tell it immediately, but we must slowly break the news and give them hope. There was hope. She would be completely all right. You tell them the truth and make sure, that you tell it in a nice way and give them hope that things would be, whatever hope is possible. I think that's one thing I would tell the caregiver. These are the memories that keep haunting me. The second thing that I like I said before, you have to balance your time. How much time? I know caregivers, that have spent, so Nalini's on the chat, but, they spend every minute, every day, every minute with their mother because there was so much love. So there was full, concentration on her. But, I was balancing between various things at the same time. So I think one must balance time and give enough time. I didn't realize because my daughter did ask for it, but I think I could have done a better job. A third thing when I look back is, I wish because at the terminal illness, I should have spoken and asked the right questions to the doctors. How long will it be? What will happen? And things like that. I had, in a way, switched off and I didn't discuss and talk and say, what is it I should, be expecting and things like that. So neither did I ask for the details and my daughter did. What else? I think, counseling, the term counseling never came up at all. There were, the doctor had said that if she feels depressed, please see the psychiatrist and he'll give some medication. So this was, if you're depressed or anxious, see a psychiatrist. But the term counseling was never mentioned. And today when we work in palliative care, we know counseling is so important right from the diagnosis of the disease, not at the end, but right from the diagnosis of the disease. And the last thing I think that I would say that the memories at end of life was really miserable the last 3 weeks because I didn't know where to reach out for help. Now we talk so much about palliative care, but there was no one for total pain relief, for comfort, to make that end peaceful and pain-free and things like that. So that was a real, I think, a really horrible part of her life and ours as well, because it wasn't the best it could have been. And that's why I think I had never heard of palliative care. So I think that those are the things that sometimes haunt me and say, this is something you could have done much better.
The thing about caregiving I often find is that there isn't a gold standard, and it can always, there's so many things that can be done better and more. And many caregivers are left with this feeling, I wish I had done this and I wish I had done that. But please know that that we love you and that we are very fond of you, and that we are very grateful for all the things that you have done. So please tell us, you didn't know about palliative care at that time, but there are so many other things that you eventually did. So can you tell us about your journey after Romila, and how did you make the most of that experience?
So I'll tell you what, Bhavana, after I lost her and I felt that I didn't know, I could have done a better job. What is it? It kept on haunting me. What else could I have done? How could it have been better? So I kept searching. And I kept saying, what is it people do? What do they do outside? Where? And finally I find out there is something like palliative care. And I realized that, Tata has a degree in palliative care. They do home care, but for a different set of people. And I had not heard of it first. And secondly, that palliative care is there, and there can be home palliative care, which we had not heard of at all when at that time. And these people help you to really, you want your loved one close to you, want them at home, but make that end of life really a painless and a beautiful experience for everybody. So once I found that out, Bhavna, I said, I'm going to start a palliative center in Romla's name. I said, no one should go through what she went through, what we went through at home. And therefore, once I learned what palliative care was, I started, searching how we could start it, where we could start it, and things like that. And,
so for our audience who might not know what palliative care is, or who might have misconceptions of what palliative care is, often people think palliative care is something you do when you have given up, and nobody wants to give up on their children. So could you tell us and our audience, what is palliative care?
So, palliative care is, what we are looking at is the suffering of a patient. We're looking at, doing something about suffering of the patient. And like we know, suffering is not just physical suffering, just pain. We're talking about what emotions the patient is going through. They're looking at spiritual suffering. And palliative care is not looking only at a suffering of the patient, but also what the caregivers are going through. The emotional, psychological, the social, suffering that a caregiver is going through. So palliative care is dealing with all the suffering of both the patient and the caregivers. The second is palliative care is not for cancer. People think palliative care, cancer. No, palliative care is for all diseases that have life-limiting diseases. It could be paralysis, it could be stroke, it could be dementia, it could be chronic lung disease when you have a lung disease that cannot be cured. It could be HIV, AIDS, it could be a chronic heart or kidney disease. And you start palliative care not when the patient is really serious and end of life. That is where we fail. That's where I'm saying, Bhavana, we fail. Start palliative care at the diagnosis. So through the disease, as the disease progresses, it's not you continue your chemo, continue your radio, continue whatever treatment you're taking for your lung, your heart, your kidney, that treatment continues. It is never stopped. But together with this is an additional cloak that is looking at your suffering that the patient and the caregivers are. And this palliative care continues through the diagnosis, through when no treatment is possible, and through the end of life. So at the end of life, when you struggle, what to do, like I did, what to do, how can it be pain-free, how can she be comfortable, how can we, even through that and even after death. So, the thing about palliative care is, and this is exactly what we try to offer at Romla Palliative Care when we're looking at we have doctors, we have nurses, we have a whole team. Palliative care is not one person. You have a team of doctor, nurse, counselor, a social worker, and other people, physiotherapists, occupational therapists, dietitian, so that they're all come together and they help that patient right from the diagnosis to the end of life. And what I'd like to tell you, Bhavana, what is important today is that there are a whole number of organizations. When I lost my daughter, we didn't know, but today there are lots of people working in palliative care. For example, you have Pal Care that is started by Feroza, who also lost her husband. You have people specialized in palliative care who studied palliative. You have hospitals offering palliative care. So we have a whole network of palliative care. And most important, Bhavna, everybody's heard of Shanti Vedana, where you put patients when they're died. Now we're starting at King George V Hospital. Just the OPD started for all, not cancer, but all life-limiting disease, where we'll admit patients for some time, teach the relatives how to look after the patient, then send them like a respite center for palliative care. So things are moving, things are changing, and it's not me, but a whole team of people that are looking at palliative care to make people's lives more comfortable.
I know that you've been instrumental also and the guiding force behind the Mumbai Palliative Network, and how you insist on it being a collaborative network, and you insist on the fact that we should share and we can work together, because there is just so much to be done. And I would like for you to talk about how, there is a need for healing for the caregiver, because very often people think once the person that they are looking after is no more, then the caregiving journey is over. And as if, you could turn a switch on and get on with your life. But we know that that's not true. So could you tell us about, your experience with healing, and what would you advise people to look at this critical transition of death?
I'll tell you, Bhavana, when we talk about healing, the process, of course, there's no switch you can, like you say, you can turn on and off. And there are two types of personalities. I know people, I know friends, when they lose their loved ones, they give up on life.
Yeah.
They go into total depression, and they just don't come back. You don't see them. And you wonder, they say, no, now I've lost someone, I cannot do anything at all, which is really not correct. And because this was not, you can't change it now, but because throughout the, like the caregiver, what you're trying to do, throughout the journey, they need the support, to start thinking about it, to work on themselves, to start the healing process throughout, so that, and when they know that the end will come sooner or later, so there is some hand holding that happens throughout. So this is one. The second is the type of personality that will probably say, I'm switching off when I'm doing something, getting on with life, but that within yourself, deep down, there might be anger, there might be resentment, there might be so many emotions that one feels, and they can be, the way they channel it might be in a very negative fashion. You don't know, suddenly, you suddenly emotionally become more anxious, you become more depressed, you are more aggressive, your emotions, it's not you're like that, but you channel it because of what you have gone through. And therefore, I feel that from my experience, if you channel your emotions saying that, let me see whatever I've gone through, how can it help others, then I think you're channeling. One is that. The second is you've got to work on yourself. What is it I need to do so that I get over what I'm doing? So one is, the exercise you do, or the yoga you do, and what you've been starting, what you've started, Bhavana, caregiving groups of people meeting. We're talking about healing. So when people get together, we have in our own groups people suffering from certain diseases, for example, cancer of the breast. They come together when they discuss, when they talk, when they share. That itself is a tremendous method of healing. So I think what you have started itself would be a good way to draw people in, so they get together, they speak out their emotions, what their feelings are, and that itself is a process of healing. So I think you have to work on it yourself. You let other people reach out to you. Join groups like you are creating, so that they can, they can heal and come back to what they would have normally got out of life.
As you were speaking, I was reminded that when I lost my father many years ago, almost 22 years this year, but at that time I thought I was being very brave, and I was, like all cool, calm, and collected, and I was being brave, and I will get on with life, and I'm not an emotional person. And I never realized how much I needed to grieve, and how much I needed to find some place where I could express myself until many, many years later, until, feel that I can express myself. So what is your experience of grieving?
My experience in what, Bhavana?
Grieving.
Grieving, okay. You know what, I think when my daughter was first diagnosed with Hodgkin's disease, and when she, where I got the news, I got the report in my hand, I said that if I tell her what it is and I get upset and I start crying, how is she going to deal with it? And I think I didn't know there was an actress in me. But I put on a face that is all is well. Like I told her, you've got a rubber gland disease, it will melt and all. I talked so much about it that I didn't stop to, digest what is happening and all. When I lost her, I think the process of wondering what we did, I think there was a family sort of a grieving, We had people who came and spent time with me, my family, her husband, some cousins of mine. So all of them came, and what we did was just kept talking and talking and talking about her. The good things, what happened, what went wrong, what were the good times we had. So that took, and it was on. We met every single day, and we talked and we talked and we talked. So when today they say, now we know that there are different stages of grieving, but in my mind, personally, I don't think I went through any of these stages of grieving, because I had accepted the fact long ago that I was going to lose. Actually, twice she came out of it, and had accepted the fact that I would lose her. So those 5 stages of grieving was really not there. But I know what helped me in grieving is having people around, being able to talk, and also because like I'm talking now, I talk to friends, I talk to relatives, and that itself, for my grieving process, I think that is.
Yeah. I am I'm looking for words, and I'm rather overwhelmed, I have to say, but I am also so hopeful, I have to say, because very often either, journeys and stories like yours are, made into, put on a pedestal or seen so far away, or they are never spoken about. So I feel that, you have made it so much easier, and, you have made it so easy to relate with so many details. I'm feeling so connected, and I'm feeling so grateful. I have a very strong feeling that many who will be watching this will get inspired and learn from you. As you look back at this conversation, what has from the point we started saying that, okay, let's have a conversation about this, and, you came to the point of saying, okay, I will have this conversation. How has that journey been for you? And how do you feel now?
I can't hear you too well, Bhavana.
I said, from the point we started talking about this topic, and initially you had some reservation to the fact that we have finished this conversation almost now. How are you feeling about it now? I mean, we certainly are very grateful, but how are you feeling?
I'll tell you, I'm feeling good because then I looked at Ramla. We started with a picture. I looked at her, how beautiful she was. I went back to what she was as a person and how she, in many ways, she reached out, made my life so much easier. All the fond memories also of, the way the good times we had, the way we ate out, the way we shopped, the way we traveled. So it's giving me a good feeling. Yes, Romla and I had a very good time together. And like in life, we all make mistakes, and I must have made enough mistakes. But I think that, it's sort of, in a way, it sort of helps. And when you talk about it, I said, let people learn. And in that learning, if they don't do the same mistakes, then I feel in some way I'm healed as well.
We would love to hear from participants or anyone who may have questions. So if there are any questions, I would request you to leave them in the chat box and we can ask those questions. I have one question for you while the questions come, which is that there must have been extra pressure on you in being a physician yourself, in saying that, there must be some inherent expectations that, oh, you're a doctor, you should know how to go about this. So the tension between a mother and a doctor. So there must be many doctors out there who also have similar tensions. We've been speaking so far to the family caregivers. How about talking to the doctors and physicians? And what would you say to them?
So I think, as a doctor, I think if your child has faith in you, my daughter had absolute faith in me. And she would say that, I know my mother will do her best. But I remember when you say that, people ask questions, my son-in-law once asked me this question. He's not a doctor. He said, Mommy, you all are both doctors. You all know all the doctors and all. How come you can't do anything to get her out of it? So that sort of a, that sort of a question comes. But what I would tell doctors is, you all are doctors, you're there to diagnose and treat and you want to cure. But please remember, every single doctor, I would like to give that message. When you can't and it's not possible to cure, please help the patient, please help the family to get in palliative care as early as possible because they need that support. People need the support. It will make it much easier for your patient. You continue treating the patient. We're not saying you continue treating the patient, but that extra support, please get it on board. And the second thing is that doctors must also accept that, you are trying your best and they can not always be miracles and drugs to cure everything that you come across. And doctors have lost all patients, in their lives must have lost enough patients. When it happens to your own person, you think it should be different. So one needs to accept the fact that we are not gods, but we are human doctors.
Great words of advice, I have to say, and very important. And do you think there is something you would like to tell? So there is a question here, which is that I know someone who is a parent and who is a caregiver, and as a well-wisher, I don't know how to support them. What can I do?
I think as a well-wisher, the support you can give is by being there, but not opening, saying that, how can I help? What is happening? Don't show your sympathy. Don't talk too much. Say, what can I give you? But the fact that a well-wisher and the parent and that patient would know that if they need help, you are around. So the fact that you're a well-wisher, you must say, I'm around anytime you need me, 24/7. Here's my number. Can I call? The second, I think if you're a caregiver, you know what you need to do is that if there's something that patient likes or the family likes, they won't say, can you cook this for me or get this. Maybe this is what something they can send across because they know they will enjoy it. You know, and running around for, medicines, running around for, these are things that they can have.
So there's another question, which is that sometimes the person who is unwell, they pick up the senses, right? So even if it's a small child or if it is a grown-up person who knows they are visiting the doctor too often, they are getting the reports, they have a sense that things are not okay. And yet in the field of palliative care, we are often told that you must have a conversation with the patient. That sometimes feels cruel. Do you think we really need to have that conversation? That's a question.
I think what palliative, I did have. Actually, when my daughter, 2 days or 3 days before she died, she said, Mommy, will I live to Christmas and my birthday because I want to celebrate it? And I said, yes, you will. And she died on the 24th of September, a few days later. So at that time, point of time, you don't tell the patient the truth, So I think you must choose to not tell them, exactly what is happening. But if they ask you, the way the counselor tells us in palliative care, what is it you know about your illness? What are you feeling? What do you think would happen? So you are starting a conversation on what the patient knows, what the patient feels, and where the patient wants to go. And you tell them only so much as to still give them hope. Not as much as say that everything is hopeless and it's like they do in some countries. You have 35% or 10% of chances of survival, and survival time is 3 months. That's no way to talk to any patient. So you ask how much they know, how much they need to know, and then talk to them in a way that is always open. We're all trying our best. Let's see what happens. You never know. And for me, the most important thing, and I did it all the time in the hospital, is God knows best, and we are leaving ourselves, your life and mine, in God's hands. And in India, if almost most people, at least in our country, we are fortunate, and especially the ones that we had in our hospital, they all had faith. So I used to say, we are only doctors. We are trying our best, but you need to leave it in God's hands. So that is what we need to do. But I would openly confront the patient or tell the patient that what needs to be done. What is the truth?
So if I were to summarize, you're saying be sensitive to the fact what kind of a person you're dealing with, what is the age of the person, what are their style and preference. There are some people who are able to take it better than others. And
Yes.
I think we have to also be sensitive to the culture that we belong to, the kind of faith and upbringing we've had. I suppose different cultures will have a different approach. And
Yeah, Bhavana, you put it very well. It all depends on the person. Some people want to know the truth immediately.
yeah.
They want to plan what they want to do in life, their wills, their property, whatever it is. So they want to know. So it all depends on the type of person you're dealing with and how much they want to know.
Yeah.
You're right. And depending on their culture, their faith,
Yeah.
you're quite right.
Yeah. There are no formulae and algorithms to these things. And the more we share, the more we learn. I think there are no other questions. And what I would like to do is, on behalf of everyone, thank you for bringing so much love and affection on the first webinar of the month of love. Thank you very much. We will be celebrating this new form of love and this form of honoring and remembering our loved ones. And as Sonalini says, our gratitude and love always. Avni says that we learn something from you every time we listen to you. Pranabda is also very grateful that you're carrying the spirit of Romila, of
Yes, I know she's there. She's there in every patient in the palliative care unit that is better. I know she's there.
yes, absolutely, and the sheer determination to live life to its fullest. We are very grateful for your time and your insights and your wisdom and your encouragement. So thank you very much.
Thank you, Bhavna. Thank you for being there for caregivers. I
Yes.
hope many more people come and make
Yes.
the most of it. Okay,
Thank
bye.
you so much. Thank
Welcome,
you.
welcome.
Here's wishing everyone a fantastic weekend of lots of love and warmth and celebrating life. How much ever difficult some of our journeys may be, how much ever we might miss and remember our loved ones, here's to celebrating life. Thank you very much.
Bye.
Bye-bye.